ओंटारियो ਦੇ ਪ੍ਰੀਮੀਅਰ ਡਗਫੋਰਡ ਨੇ ਮਿਸੀਸਾਗਾ 'ਚ ਕੋਵਿਡ-19 ਵੈਕਸੀਨ ਸੈਂਟਰ ਦਾ ਦੌਰਾ ਕੀਤਾ ਹੈ, ਜਿੱਥੇ ਉਹਨਾਂ ਨੇ ਪੱਤਰਕਾਰਾਂ ਦੇ ਸਵਾਲਾਂ ਦਾ ਜਵਾਬ ਦਿੰਦਿਆਂ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਸੈਂਟਰਾਂ ਦੇ ਅੰਦਰ ਵੈਕਸੀਨ ਪ੍ਰਕਿਰਿਆ ਤੇ ਇਸ ਦੇ ਸਾਰਥਕ ਨਤੀਜਿਆਂ ਬਾਰੇ ਵੀ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਹੈ। ਇਸ ਦੌਰਾਨ ਉਹਨਾਂ ਨੇ ਪੀਲ ਰੀਜਨ ਅੰਦਰ ਕੋਰੋਨਾ ਦੀ ਸਥਿਤੀ ਤੇ ਚਾਨਣਾ ਪਾਇਆ ਹੈ।
Well, Minister Fullerton's done a great job in long-term care right from day one, and we value all the information as being a physician herself that she could give us, and I just want to say she did a wonderful job.
But did she ring the alarm bells, or she said she rang the alarm bells about the spread in nursing homes and asymptomatic spread before Dr. Williams? Did you listen to her?
I listened to all the medical professionals, including Dr. Fullerton, and always take her advice along with the Chief Medical Officer.
Okay, I'm going to a question from Brian Lilly now. And this all deals with the guidelines. They walked them back in Peel when Mayor Brown suggested that people are following the guidelines and means that a 5-year-old would have to stay in a room for 2 weeks at a time. Have you walked back from the guidelines? Do you know about those guidelines before? If they were possibly exposed to COVID, that you would have to... I can let me hold the whole question. Sorry. Well, Peel Health has walked back the guidelines. Small children should be isolated by themselves after being exposed to COVID possible. The general Ontario guidelines still indicate that those dismissed from schools as a result of possible exposure be kept inside the house for 14 days and kept away from other family members. In other words, if your small child had possible contact with another child at school with COVID, they would have to stay in a room for the 14 days. Is the province going to back away from that?
Pass that over to the Minister of Health.
Okay, then I'll ask her. I'll go to the Minister of Health after that.
Can I talk about what we're doing here?
Absolutely.
Thank you.
Yeah, absolutely. Yeah.
Well, we're here at the U of T, Mississauga, and I just want to thank everyone here for putting this together. They're working collaboratively with the region of Peel, and again, I want to thank Mayor Crombie. Thank you so much, Mayor Crombie, and Dr. Lowe for doing an incredible job here in Peel region. And I want to thank Trillium. This is a collaboration that we're going to see right across the province, no matter if it's the hospitals or the PHUs or even the private sector as well. And we're going to get through this. I'm really happy to announce everyone's following the framework, but also have the flexibility to move forward once they get through their phase 1 of
ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ ਦੇ ਪ੍ਰੀਮੀਅਰ ਜੋਹਨ ਹੌਰਗਨ ਨੇ ਪ੍ਰੋਵਿੰਸ ਅੰਦਰ ਕੋਵਿਡ-19 ਵੈਕਸੀਨ ਵੰਡ ਦੇ ਅਗਲੇ ਪੜਾਅ ਲਈ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਹੈ। ਉਹਨਾਂ ਦੱਸਿਆ ਹੈ ਕਿ ਸੂਬਾ ਕੋਵਿਡ-19 ਟੀਕਾਕਰਨ ਦੇ ਦੂਜੇ ਪੜਾਅ ਅੰਦਰ ਦਾਖਲ ਹੋ ਰਿਹਾ ਹੈ। ਇਸ ਪੜਾਅ ਦੌਰਾਨ 90 ਸਾਲ ਦੀ ਉਮਰ ਤੋਂ ਵੱਧ ਵਾਲੇ ਬਜ਼ੁਰਗਾਂ ਨੂੰ ਕੋਵਿਡ-19 ਵੈਕਸੀਨ 15 ਮਾਰਚ ਤੱਕ ਪ੍ਰਦਾਨ ਕੀਤੀ ਜਾਵੇਗੀ।
At the start, I want to thank all three of these individuals for the extraordinary work they've been doing, not just over the past couple of weeks or the past couple of months, but indeed over the past year to keep British Columbians safe and focusing on the things that matter most to British Columbians. You'll recall that in late January, we were the first province in the country to announce our COVID-19 vaccination plan. Our plan was to get people immunized as quickly as we could by focusing on those that were most at risk. The most severely ill that we've seen over the past number of months have been those who are in their latter years and those that have comorbidities. So our focus has been on not just those that are most susceptible, but indeed those that are most vulnerable and the people who care for them. And I want to say that it's been an extraordinary number of weeks where we've seen 275,000 people vaccinated here in British Columbia, focusing on long-term care residents and staff, people in rural and remote Indigenous communities, as well as healthcare workers that focus on COVID-19 patients. That's tremendous success based on the amount of vaccine we've had available to us, and we're very excited today to announce we're moving in to phase 2 of our vaccination plan. Although we already have about 90% of the residents in long-term care facilities and the staff immunized, we will continue to go back to those first stages, and Dr. Henry will lay out how we're going to do that in a few moments. But today, as we start phase 2, this will include, of course, seniors 80 years and better, or Indigenous elders 65 years or older. And through March and April, we plan to immunize another 400,000 people, building off the successes we had in phase 1. That means using the same mobile clinics that we were so successful in phase 1 to make sure that independent living facilities are immunized, as well as not just residents but staff, to meet that target. Dr. Ballum will lay out in some detail in a few moments the overall plan for phase 2, but I want to just say before we start the detailed briefing that although there is light at the end of the tunnel, we are far from out of this.
ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ ਦੀ ਮੈਡੀਕਲ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਬੋਨੀ ਹੈਨਰੀ ਨੇ ਕੋਵਿਡ-19 ਵੈਕਸੀਨੇਸ਼ਨ ਦੇ ਦੂਜੇ ਪੜਾਅ ਲਈ ਰਣਨੀਤੀ ਬਾਰੇ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਹੈ। ਇਸ ਦੌਰਾਨ ਉਹਨਾਂ ਨੇ ਕੋਰੋਨਾ ਵੈਕਸੀਨ ਦੀ ਪਹਿਲੀ ਅਤੇ ਦੂਜੀ ਖੁਰਾਕ ਦੀ ਦੇਰੀ ਬਾਰੇ ਵੀ ਜ਼ਿਕਰ ਕੀਤਾ ਹੈ। ਨਾਲ ਹੀ ਉਹਨਾਂ ਨੇ ਕੋਵਿਡ-19 ਵੈਕਸੀਨ ਦੇ 3 ਮੁੱਖ ਟੀਚਿਆਂ ਬਾਰੇ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਹੈ।
As you know, throughout this pandemic, our goals have been quite clear. Our 3 main goals have been to do all we can to prevent people from getting seriously ill or dying from COVID-19, to keep our health system fully functioning so that anyone who needs the care that can get the care that they need when they need it, and of course to minimize as much as we can the disruption to our society, although we know that it has been profound. These goals have guided our decision making on our pandemic response and on our BC immunization program. The scientific evidence has proven that the single most important risk factor for becoming seriously ill or dying from COVID-19 is age. The older you are, the more at risk of severe illness or death you are. That is why here in BC, like many jurisdictions around the world, the foundation of our immunization program is an age-based approach to first protect those who are most vulnerable or caring for the most vulnerable in our long-term care, assisted living, and now moving out into the community. We are starting with our oldest and most vulnerable and working from there. But we now have some new tools. First, as we heard on Friday, we now have 3 safe and highly effective vaccines available for use in Canada. The addition of the AstraZeneca and Serum Institute of India viral vector vaccine, which has been used quite a lot in many countries in the world, particularly in the UK, which will be supplied from these 2 manufacturers, allows us to be more agile in where and how we can immunize people here in BC. Unlike the vaccines that we've had so far from Pfizer, BioNTech, and from Moderna, this is a vaccine that is stable at fridge temperatures, so 2 to 8 as we call it in the immunization world. That means we can use our community infrastructure and we can be much more flexible on how we can immunize people. We can use our established distribution systems because no special freezers are needed.
ਟੋਰਾਂਟੋ ਦੇ ਮੇਅਰ ਜੌਨ ਟੋਰੀ ਨੇ ਬਲੈਕ ਹੈਲਥ ਵੀਕ ਦੀ ਸ਼ੁਰੂਆਤ ਬਾਰੇ ਜਾਣਕਾਰੀ ਦਿੰਦੇ ਦੱਸਿਆ ਹੈ ਕਿ ਬਲੈਕ ਮੈਂਟਲ ਹੈਲਥ ਵੀਕ ਦੀ ਸ਼ੁਰੂਆਤ ਹੋ ਚੁੱਕੀ ਹੈ, ਜੋ ਕਿ 5 ਮਾਰਚ ਤੱਕ ਹੋਵੇਗਾ। ਉਹਨਾਂ ਦੱਸਿਆ ਹੈ ਕਿ ਇਸ ਹਫ਼ਤੇ ਦਾ ਮੰਤਵ ਬਲੈਕ ਲੋਕਾਂ ਲਈ ਸਿਹਤ ਸੇਵਾਵਾਂ ਵਿੱਚ ਵਿਸਥਾਰ ਕਰਨਾ ਅਤੇ ਉਹਨਾਂ ਨੂੰ ਬਿਹਤਰ ਸਿਹਤ ਸੇਵਾਵਾਂ ਮੁਹੱਈਆ ਕਰਵਾਉਣੀਆਂ ਨੇ।
Black Mental Health Week began today and will run until March 5th. This week is a call to action for more support and access to culturally responsive mental health services and programs for our Black residents. It's a recognition of the impacts mental health problems have on the Black communities, which has been further heightened during the COVID-19 pandemic. Experiencing systemic inequities, discrimination, and microaggressions are social stressors that increase the risk of negative physical and mental health challenges. I have learned from listening what that means. It means that acts of racism one experiences are going to cause you stress at that moment and later. It means anxiety about your kids and some of the discrimination they may be facing at school or in life generally. It means the kind of stress I can't imagine created by the possibility that always is there that due to the color of your skin, something will happen to you when you go out for a walk or enter a store. Things as simple as that can cause a lot of stress, and this kind of anxiety and stress can and does affect mental health. And that's leaving aside entirely the whole matter of access to mental health supports, which are scandalously lacking in this province as a whole, and even to a greater extent in our Black communities. So that is why Black Mental Health Week is such an important one during which to acknowledge this and to raise awareness. I encourage all residents to participate in Black Mental Health Week by seeking help for mental health care or encouraging someone else to do so. Supporting organizations or institutions to adopt a plan to increase accessibility to culturally responsive mental health supports. inspiring community-led activations that advance existing mental health resources within the community, and sharing personal stories so that others in the community know that they are not alone. Details about events happening this week can be found at www.blackmentalhealthweek.ca. My hope is that by recognizing Black Mental Health Week, we can bring awareness about the impact that anti-Black racism has on Black Torontonians, and that we can support our community partners who in turn are supporting Black Torontonians, and encourage the development of more support services for people affected by mental health issues.
ਟੋਰਾਂਟੋ ਦੀ ਮੈਡੀਕਲ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਡਬੇਲਾ ਨੇ ਟੋਰਾਂਟੋ ਅੰਦਰ ਕੋਵਿਡ-19 ਆਊਟਬ੍ਰੇਕਸ ਬਾਰੇ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਹੈ। ਉਹਨਾਂ ਦੱਸਿਆ ਹੈ ਕਿ ਅੱਜ ਟੋਰਾਂਟੋ ਅੰਦਰ 312 ਨਵੇਂ ਕਰੋਨਾ ਕੇਸ ਰਿਪੋਰਟ ਕੀਤੇ ਗਏ ਹਨ। 298 ਮਰੀਜ਼ ਹਸਪਤਾਲ ਵਿੱਚ ਭਰਤੀ ਹਨ ਅਤੇ 62 ਗੰਭੀਰ ਬਿਮਾਰ ਆਈਸੀਯੂ ਵਿੱਚ ਜੇਰੇ ਇਲਾਜ 'ਚ ਹਨ ਅਤੇ ਨਾਲ ਹੀ ਇੱਕ ਮੌਤ ਹੋਣ ਦੀ ਪੁਸ਼ਟੀ ਉਹਨਾਂ ਕੀਤੀ ਹੈ।
Today, I'm reporting 312 new cases of COVID-19. 298 people are in hospital, and 62 people are in ICU. Sadly, I'm reporting one new death. 1,179 cases have screened positive for mutations and are expected to be confirmed as variants of concern. A week ago, that number was 511. The increase of confirmed variants of concern continues. We have 121 cases confirmed as such. 117 are the UK variant B117, 3 are the Brazilian variant, and 1 is the South African variant. The steady identification of the variants is something we continue to watch very carefully. Vaccination will be vital to countering the continued spread of COVID-19 in any form. And today, I will describe for you the role of Toronto Public Health in vaccination delivery. First, I want to reaffirm the goal and then the resources working to achieve it. As an intervention, the case for vaccines is clear. I've said before, and am happy to say again, that here in Toronto, the reduction of the spread in long-term care and retirement settings tells us all we need to know about the capacity of the vaccines to substantially reverse the threat of COVID-19. While vigilance is required still, the case counts and severity of illness indicate the threat to residents in long-term care and retirement homes is heading in the direction we want, particularly given the heavy price paid in those settings for most of the pandemic. Those results also demonstrate why the vaccination of people on a basis that considers their risk.
ਬ੍ਰੈਂਟਨ ਦੇ ਮੈਡੀਕਲ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਲਾਰੈਂਸ ਲੋ ਨੇ ਪੀਲ ਰੀਜਨ ਅੰਦਰ ਕਰੋਨਾ ਵਾਇਰਸ ਦੀ ਸਥਿਤੀ ਬਾਰੇ ਅਪਡੇਟ ਪ੍ਰਦਾਨ ਕੀਤੀ ਹੈ। ਉਹਨਾਂ ਦੇ ਨਾਲ ਕੋਵਿਡ-19 ਵੈਕਸੀਨ ਵੰਡ ਦੇ ਟਾਸਕ ਫੋਰਸ ਮੁਖੀ ਜਨਰਲ ਰਿਕ ਹਿਲੀਅਰ ਨੇ ਪ੍ਰੋਵਿੰਸ ਅੰਦਰ ਕਰੋਨਾ ਵੈਕਸੀਨ ਵੰਡ ਪ੍ਰਕਿਰਿਆ ਬਾਰੇ ਵੀ ਜਾਣਕਾਰੀ ਦਿੱਤੀ ਹੈ।
Yeah, no worries. Thanks so much. So it came to my attention over the weekend that a communication product put out by Peel Public Health contained an error. This product has since been removed and is currently being revised. The product does not state our position in respect of isolation of children. There are recommendations on our website with a recognition that children cannot self-isolate, and they do need to self-isolate with a parent or guardian. It is important that these guidelines were done with the best intentions, with a recognition that household transmission does continue to be a significant source of spread in our community, and to the extent that we can balance the risk of transmission, certainly with the emotional and physical needs of children, that was where we were trying to go, but the product has been removed and is being revised. Thanks for the question.
Was it just not following the provincial guidelines?
So no, again, this was an error made on a communication product. It was not a difference in the positions with products.
There's no confusion. Some regions are opening up more quickly because they started earlier. They are more advanced in their priorities and can start with 80-year-old pluses before other regions can. And the reason some of those regions started earlier is because they were hot zones. For example, Peel here has been particularly heavily, devastatingly visited by COVID-19, and so started early, and they therefore are now actually ready to do 80-year-olds and plus, and indeed have been doing that. Yeah, I've heard that some of the websites have had some problems and or crashed this morning. You know, people are still getting needles put into their arms. That's not stopped because of that. You know, Hamilton or York, they will fix those websites. They'll get back online. But in the interim, the bookings have been made and people will continue to get needles into their arms.
But there is confusion there, and people are so emotional about this. A little bit of confusion creates a lot of ire. What do you have to say to those people that tried to get a wet needle today and can only get it for one spouse or one person and not the other? All of the confusion.
And so it's not all this confusion as much as the availability of vaccines will sometimes cause that to occur, where you could get a needle because you're an age group and your spouse potentially cannot. As we get more vaccines flowing through those vaccination centers, those kinds of issues will disappear, and they'll disappear very soon here. So we're constantly pushing hard. We're actually moving in front of where I articulated last week. I said we were going to be province-wide by 15 March. At 80-year-olds and plus. We've already started in many of the public health units, and we'll continue to ramp that up so that by 15 March, we will be doing 80-year-olds and above right across the province of Ontario.
Just one prevention.